Good afternoon, ladies and gentlemen. Debbie Evans and I are joined today by Professor Norman Fenton. Now, Professor Fenton is that rarest of breed, which is someone speaking out in an accurate, factually based, and non-ideological way against the narrative from academia, against the government narrative, against the prevailing way the wind is blowing. This used to be common in academia. It used to be expected. It used to be the norm. It is no longer. We find ourselves having lost our institutions in very large part to a very ideologically driven, very narrow and very censorious viewpoint. This viewpoint, you call it neo-Marxism, you call it critical theory, you can call it woke ideology. There are many names for it, postmodernism. All of these things have shed some light on what we're dealing with. But what's happened, there's been a long march through the institutions. The institutions have fallen. And now, to tell the truth becomes a dangerous thing for someone in academic life. And only the brave need apply. And this brings us to our guest, Professor Norman Fenton. Welcome.
Hi, thanks for having me on again.
If we can start with Professor Fenton versus the Lancet, what's been happening here?
Okay, so this is just one of several instances that I've had in censorship of anything that we've tried to get published on the COVID data, and particularly anything on the safety and effectiveness of vaccines. So this is just one example of the censorship I've encountered. So basically in early May 2021, the Lancet published what we've regarded was a blatantly flawed study into the effectiveness of the Pfizer COVID vaccine. But it was an important study because it was the first one, I believe, that was a whole population study. It was a whole population of Israel. It was an observational study that was claiming 95% effectiveness for the vaccine. And that was an important figure because it just so happens to be the same effectiveness figure, 95%, which Pfizer claimed for the original clinical trials. So people thought, the clinical trials, that was on a special, they're mainly a younger population. But here we've got the vaccine rolled out to something like 80%, 85% of the Israel population. And now we can see that it's 95% effective on a population level. So this was really, and this was trumpeted all around the world. Well, there were so many blatant flaws in this study. I mean, there are flaws in the study which are actually the same flaws in all of the observational studies that you see on vaccine effectiveness and safety. So we picked out a couple of these flaws. I mean, for example, one of the obvious ones is that they count anybody who gets COVID or test PCR positive within 2 weeks of their initial jab is counted as unvaccinated. So that's counted as an unvaccinated COVID infection, which is of course ridiculous. But you've got all that. But there are other systemic flaws which we pointed out. And we submitted a rapid response 250-word letter explaining why the study was flawed. That was on the 17th of May, 2021. We got a kind of an initial acknowledgement saying that they would ask the authors of the study for a response. We didn't hear anything at all for 20 months. Then out of the blue, on the 8th of January, 2023, we get an email from the Lancet senior editor, Josephine Gibson, apologising for never having got back to us about our letter, but saying that the lead author of the study, which is a woman called Dr. Sharon Alroy Price, had been asked to respond to our letter, but because she didn't provide any formal response, they decided not to publish our letter, which is a curious thing. So we tweeted that Lancet response, and within 24 hours, it got over 1 million impressions. And we also published a Substack article highlighting the fact that we were now aware of addition, because we actually did some checks, and we did some checks on this lead author, Sharon Alroy Price. And we found some very interesting things that she basically had to say she had a close relationship with Pfizer is an understatement. And that, of course, was never declared. They did declare there were 15 authors of the paper, 8 of whom declared that they did indeed hold stocks and shares in Pfizer, but she didn't have any conflict of interest stated. And yet it turns out she was actually the Israel Ministry of Health lead liaison person on the government's relationship with Pfizer. So anyway, because this all went kind of like viral on Twitter, the next day we got an unsolicited email from the Lancet, from the same Josephine Gibson, which was clearly only a result of the reputation hit they were getting from our tweet, saying, "Thank you for bringing your letter back to our attention. We're looking into the next steps, and we'll get back to you as soon as we can." And it turns out we then, I then made her aware of the additional concerns we had about the paper because of the conflict of interest, failure to state that. And on the 11th of January, the next day, we got an email back saying, we are now inviting you to publish the original letter or an update to it. That's fantastic. They've actually agreed to this. So we sent our letter with an update, and lo and behold, almost immediately we got a response saying they've decided not to publish the letter. I mean, it's quite astonishing. So that wasn't the end of it, of course. So what I did was I then decided to submit a freedom of access request to Elsevier, who actually are a subject access information request to Elsevier, because they're the publishers of the Lancet, asking for all internal correspondence between the editors and reviewers relating to the submission and ultimate rejection of our letter. And actually, I wasn't actually expecting a response at all, but they actually sent back a response about 3 or 4 weeks later. And there was a cover letter, but they actually had a 9-page document with all of these emails, and most of it was redacted. But what was remarkable, that even though most of the details were redacted, there was enough information in what was unredacted to see that the refusal to publish our letter had nothing to do with the quality and accuracy of our complaints against the article, but simply because who I was. They were trying to dig the dirt on me, basically. And they were sort of saying, it doesn't, so they were sort of reluctantly accepting that actually I do seem to have a valid professorship, but, look, this guy has been pumping out anti-vax, has been retweeting tweets from anti-vaxxers and stuff like that. So this was all there. And they were referring to me as a problem, that they were saying they'd got some helpful background information on Fenton, which we suspect, could have been furnished by the 77th Brigade or whatever. We don't know, but someone provided a dossier, and there's plenty of people out there who have, of course, been trying to dig the dirt. And so it turns out that they were only, they were sending this, they were clearly sending just the initial letter, invited us to resend to where they said they would actually publish it. It was clearly just a holding email. They never had the intention of publishing it. It's bizarre.
That's quite a story, and well done for using subject access request. I remember in the early days of freedom of information, Mark Steele was in the fight with, I think, the BBC, and he put in an FOI or a subject access request for all the information they held on him. And he eventually got a lot of information, including the internal discussion within the BBC on how to avoid releasing that information. It was kind of the gift it kept on giving. Well played. And I did pick up, I think it was Debbie that sent it through, a song based on The Sound of Silence, all about silencing science. And it was mostly focused on COVID and related matters, but it was a general commentary on the search for truth is being closed down. And the best line, because it was based on the Simon and Garfunkel song, and the best line was, "The words of the prophets are written in the Substack mail and Twitter jail." And I thought that was just genius. And it does show that it's in these less regulated means of communication lie the last areas where the truth has a chance to actually be heard. The fact that your Twitter record has been used to assess whether you're suitable for publication in a journal like The Lancet and not your publication record in learned journals is quite bizarre. I've got some follow-on questions, but before I do, can I just hand over to Debbie and welcome her onto the discussion, and just ask Debbie, what are your initial thoughts on this?
My initial thoughts are absolutely staggering, because here we have Professor Fenton, a world expert, who's all of a sudden now a nobody because of his stance of telling the truth. And this brings me back to experts, and we've been talking about experts on the column for a while, and it's down to public trust. Because who constitutes what an expert is? If I choose to listen to Professor Norman Fenton, which I do, as an expert, then how are we meant to ask the rest of the public to trust Professor Fenton as well if other people are discrediting him? So it all comes down, really, I think, to public trust. But again, the bravery of Professor Fenton in standing up, I think my biggest question is, who are these people? Who are these other academics that are putting out this narrative so that we're not to believe the likes of Professor Fenton? And I think that's my big question to Professor Fenton, is who are these other people in academics or in the academic world that are being allowed to pump out this completely false narrative?
Well, they're what I regard as the captured academics. They're the ones who are, in this case, funded by the sort of big pharma, the Bill and Melinda Gates Foundation, but actually increasingly anybody who even gets funded by the UK sort of Engineering and Physical Sciences Research Council, by UK government funding. You've effectively got to declare a commitment to the kind of like the woke ideology. You have to even every time you prepare a grant now, you've got to make a statement about sort of what you're going to do about equality and diversity and all that kind of stuff. So, but even for a very, very long time, this what I guess can only be described as a kind of sort of a Marxist ideology is very common amongst in academia, and I think in particular over the COVID issue, starting with the lockdowns, that was something that was very much was incredibly welcomed by most academics and those who had, especially those who, of course, had the ear of government, those who are on SAGE and then who this sort of self-promoting people on iSage. These are all people who have a kind of like a world view which is driven towards that kind of that desire for sort of global governance and authoritarian control. So those are your kind of captured academics, and those are the ones. I've got no idea why. I mean, we've had a conservative government for a long time, and yet they were being advised throughout the whole COVID crisis. Look at the names, look at the people. You've got people like Susan Mickey, of course, who was the person mainly behind the sort of the Project Fear and the whole spy, that SAGE spy stuff, who are openly communist. But there are plenty of others. Most of the others are sympathetic to that way of thinking as well. These are the people who, unfortunately, are the only ones who seem to be accepted as experts and able to speak both to the government and to the BBC and stuff like that.
Because you were effectively employed by the BBC, weren't you, for 6 months? So you know how the BBC work. But how do we get the public trust back, Professor Fenton? Because the public are believing these Marxists, as you've called them. How do we get public trust back? And I know I'll throw back to David in a minute as well, because I know that David will definitely want to comment on what you've just said. But how do we get public trust back?
It's very difficult because let's call us, actually they might call us the sort of the COVID dissidents. That dissident voice is not allowed to be heard. I mean, going back to sort of my censorship. I mean, as you said, I had pre-COVID. I mean, I published 6 books. I've got well over 300 peer-reviewed papers. I was very well respected for my work in in decision analysis and risk assessment. And yet, as soon as I started writing and publishing work on the initial sort of COVID data, initially with the problems with the sort of the PCR, the access to the PCR testing and stuff like that, journal papers, first of all, we were submitting them to the regular journals. First of all, they were quickly rejected with minimal review. Then, next step was that they were rejected automatically without review. The third step is that the preprint servers, i.e. where anybody can put a paper, it doesn't get reviewed, that's the whole point of a preprint server, they were automatically rejecting our papers. And then the new thing, which I actually wrote a Substack article about yesterday or the day before, is that they're now attempting to go after our non-COVID papers to get those retracted with completely spurious reports, in my case, of failure to declare a conflict of interest. So the ones that I'm getting loads and loads of reports about, so these are papers got nothing to do with COVID and nothing to do with anything related to my membership of HART. They're up there saying that I failed to declare my membership of HART and PANDATE. Well, I've never been a member of PANDATE, which is a curious thing. I am a member of HART, but they're expecting me to declare membership of HART on a paper which was about, the most recent one was like statistical issues in the conviction of nurses. Nothing to do, anything, absolutely nothing. So to do with it. I mean, so where do we stop? Do I have to declare do I have to declare that I'm a season ticket holder at Spurs? Do I have to declare my Prime, my Amazon Prime membership? Where does it end?
Well, this is a good question. Season ticket at Spurs. Ooh. Yeah, you make a good point. Debbie asked an excellent question a moment ago about what makes an expert, right? And the whole standing of what an expert is in society, because it's been sadly moving away from someone whose knowledge of subject area is so clear, is so manifest, shines out of them, that can take the most difficult, complex ideas and explain them in a way that is simple and understandable by any reasonably well-educated layman, because such is their deep understanding of the subject matter, they can translate the seemingly complex into the apparently simple, a very difficult thing to do. And when you see that done well, you recognise, I believe, that you're in the presence of a significant intellect and someone who is speaking with a considerable degree of specialist knowledge. But even then, there's an implied requirement on the listener to ask questions, to think about the information that's coming in, and an implied duty on the expert to answer these questions and do so in a similar convincing manner. All of that's been lost. We now have expert as confidence trickster. We now have expert as authority figure by diktat. We have an entire system based on the logical fallacy of argument to authority. I have the post, the degree, the qualification, the job description that says I'm all-knowing and everyone else must comply. And of course, we then get into the strange world of diversity, inclusion, and equity, DIE, which you've just described how you have to make statements about to get any sort of grant for anything from the government now. Now, diversity in practice means uniformity, because you have to have uniformity of thought. Inclusion in practice means exclusion, because people who do not have uniformity of thought are excluded from the public discourse. And equity means basically discriminating against people so that some arbitrary equality of outcome amongst groups, however defined, is achieved. So it's against kind of natural justice and fairness and things like this. So these are extremely deceptive terms. Why are they being accepted? Why is academia rolled over to, and it is cultural Marxism, these cultural Marxist ideas? Why has the government done so? Why is everybody surrendered intellectually to this and not asked the questions about why? Because we managed to have very significant scientific progress and discovery over a couple of 100 years without diversity, inclusion, and equity statements. Why are they suddenly required? I find these are troubling questions about the nature of academia, and I think that's what I'd like to ask Norman to sort of explore a little bit more now. You're in this environment, you're in this world, you're seeing these strange, heavily redacted responses from organisations like the Lancet, for goodness sake. What do you think is happening? What do you think is driving this agenda?
I'm actually out of it now because I formally retired at the end of December of 2022. I'm now just an emeritus professor at Queen Mary. And to be frank, I'm kind of like quite glad to be out of it. It was very, very, I mean, the thing is, the only reason why I was able to speak out, because it would have been very difficult. And people say, well, you're brave to speak out. But I was, when the whole thing started, I realized I was not that, I had a career. I wasn't that far away from retirement. And in the end, of course, I decided I would retire. There are other personal reasons as well, but I decided I would retire because it really was that whole atmosphere of, as you say, it's cultural Marxism was getting to me, and everything about it. It's been going on for a very long time. That's the point. This is not new. This is not new with COVID. You've got just look at how far back the whole kind of like the climate change scare and the similar manipulation, misrepresentation of mathematical models, misrepresentation of data, and the censoring of anybody, if you like, dissenting against that narrative. That's been going on for a very long time. But it doesn't just stop there. It's in all aspects of academia. You have that kind of like cultural Marxism dominating what can be done. So anybody who does want to do something, I mean, science progressed. The big scientific progressions came about through dissenting voices, people who didn't accept the existing, the status quo, what everybody else believed, right? But now that you become sort of cast out. You become somebody, as I become, and as a few others who have spoken out on these issues, you become a disgraced academic. I mean, you get sort of effectively government spokesman publicly on Twitter, saying that I'm a rabid misinformation spreader. I mean, that's the extent of it. So anybody who is not close to retirement, who wants to speak out, will be in danger. I mean, there were people. The point is, many people in campaigns whipped up by other academics, were trying to get me out of Queen Mary. We're writing to Queen Mary and say, this guy's a disgrace. Why is he still a professor at Queen Mary? You get these campaigns. That will happen. It's happened to, the small number of colleagues of mine who've also spoken out. This is the atmosphere. It's the environment. Because as I said, as I was saying before to Debbie, it's this. A lot of academics are kind of like happy with this sort of new globalist authoritarian control viewpoint. It's basically what their worldview is.
Do you see any significant pushback? Is the resistance to this still in the fringes? Is it the individual human beings who will not buckle to this, fighting, shall we say, perhaps lonely battles in different institutions up and down the country? Or is there more of a realization that we have a problem here? And is there any sign of university authorities, university management realizing, this attack we've been running on freedom of speech, freedom of thought, this is a bit anti the whole university idea. Maybe we've made a mistake. Is there any sign of that?
No, there isn't. And you're quite right that you'd have thought that the universities, we know that, the problems with the mainstream media and, the other sort of organizations who are sort of bought into this sort of woke narrative, and in particular the narrative of the need to censor, right? You'd have thought that the universities would be the one institution which would have resisted that. But they've been, what's really concerned me, they've been at the forefront. You can't believe how much enormous investment there is now in the area of kind of like computer science, which is sort of an area where I was in, let's say, for a long time, which is actually dedicated to basically censoring it. They call it using AI to detect misinformation or hate speech. It's dressed up as that, enormous funding for this. But essentially, it's a mass censorship campaign. And this is big money. A lot of computer science is devoted to exactly that at the moment. A lot of government funding. All the AI funding, most of it is going into that area, which is completely bizarre. So the universities, which should have been the last bastions of free speech and those kind of like protesting against censorship, are the ones now who are leading the censorship campaign with novel techniques of new ways to censor it, trying to find misinformation why it isn't there, trying to find microaggressions when there's nothing there. This is a drive by academics.
And Debbie, you've got some specific questions. We've gone from universities and the nature of their failure to live up to the basic principles on which we were founded. We go from this to another organisation which has failed to live up to the basic principles on which it was founded, MHRA. You've got some specific questions, I think, for Norman regarding some recent statements by June Rain. Is that right?
I have, yes, and this is where it's always so valuable to have people like Professor Norman Fenton on speed dial, because when you discover some of the videos that June Rain puts out, sometimes I don't think she believes that anybody's going to watch them. So viewers and listeners may remember the latest video by June Rain, which was her lecturing at the Nicola Wheatley Memorial Lecture. And she came up with some very interesting statistics, some very interesting information. And she was also referencing Professor David Spiegelhalter's data. And Professor David Spiegelhalter was a member of SAGE, and then he kind of mysteriously disappeared from SAGE, but he's a colleague of Professor Norman Fenton's. So I was very grateful to Professor Fenton for watching this video that June Rain has recently put out, or at least the organisation has put out in Wales. And Professor Fenton has come up with some very interesting revelations, which I have to say are an exclusive for UK Column, because she's referencing serious adverse reactions in Wales. And Professor Fenton noticed something very significant. So I'm not going to say any more. I'm going to just hand over to Professor Fenton. What did you see from June Rain's revelations?
Well, it gave us really some incredible insights into the extent of underreporting of serious adverse events of vaccines or other drugs in the yellow card system. Because we've always said, at the moment, for example, for the COVID vaccines, yellow card has about 2,400 deaths recorded from the COVID vaccines, right? And we've always argued that systems like yellow card and VAERS in the USA are significantly, massively underreporting adverse reactions. I mean, some people have claimed that it's that only as few as 1 in 100 reports ever get submitted. Others have claimed it might be as high as it might be up to sort of 25-30%, but nobody has ever claimed it's anything more than 30%. So generally you get these quite low reporting rates. But what was specifically interesting about one of the slides in her presentation was the very different reporting rates across the UK. And in particular, Wales had actually a much higher reporting rate than Scotland. In fact, Wales had a 4 times higher reporting rate than Scotland. So what this would mean is that if, as we believe, a conservative estimate, we believe that there's very powerful evidence that the reporting rate is never more than 10%. Let's suppose Wales hits that 10% target. That will mean that the Scottish reporting rate is less than 3%, it's 2.5%, which shows you it gives us real evidence of the people. It shows you the underreporting rate must be very, very high for there to be such significant differences. But this has given us some real insights. And in fact, as a result of this, I mean, we did a recent report which was estimating the true number of vaccine deaths based on two variables. There's two variables. One is what is the underreporting rate, and the other one, because that whatever that is, it's going to increase the true number on the number that you've observed. But the other, people say, well, a lot of the reports that are in there cannot causally be linked to the vaccines, right? Which is true. But actually, we've done a lot of research on that, and we've discovered that there is real evidence that at most 30%, probably at most 15%, but between 15 and 30% of the reports of serious adverse reactions cannot be directly linked to the vaccine. So basically, most of them are real. You can probably assume that 70% of these are linked to the vaccines. So on the one hand, you've got to adjust the figures down a bit to account for the bogus reports, the ones which aren't generally linked to the vaccines. But then you've got to increase it, taking account of the underreporting rate. Well, from what I've seen from what June Rain presented there, I believe that the underreporting rate is worse than we had assumed. I'm sure we had assumed 10%, but we know it's much worse than that in Scotland and elsewhere in the UK. In fact, Wales was typically 3 times higher than anywhere else.
The Yellow Card Centre here in Wales is a good read from the last 21 annual report. And so what we're doing, I think, is re-evaluating how the Welsh Yellow Card Centre has contributed enormously to detecting signals. Now, if you read the report, what you're looking for is actually the non-COVID reports, the vaccines and the therapeutics, and how the centre has maintained a finger on the pulse of the safety of medicines throughout this time. And you will be incredibly impressed, as I was, to see that increase in reporting rates despite everything happening in the pandemic. How did they do this? How did you do this? And I think some of the Yellow Card champions are here today. If you want to put your hands up, we'll want to celebrate what you've done. An amazing initiative here in Wales that has, if you like, set off other initiatives both nationally and internationally. That local outreach embodied in colleagues who are going out and encouraging reporting. So let's hear it for the Yellow Card champions. And simple principles, making a pledge to continue reporting, publishing papers, having campaigns on topics of interest, all happening here. And if you want to really take a bow, Yellow Card Centre Wales, you will see some of the amazing comparisons. There's Wales. I don't think I need to say too much more. Colleagues, please accept thanks, because you are setting the standard for Yellow Card centres across the UK. And I think that really says it all in one slide. Interestingly, and a very useful piece of work looked at the impact after the reporting indicator was introduced. And this was back in 2014, the NRI. And when that was introduced, looking at a comparison between GP reporting and other groups of reporters, there was a real significant increase in the number of yellow cards from GPs in Wales that actually continued to increase year on year, even as long as the NRI was in place. So no concomitant change from other reporting groups. And again, a beautiful example of how an initiative in the centre was able to have a meaningful impact.
She also, incidentally, said something bizarre about the number of reports, because she said in that speech, she said, we celebrate the increase in yellow card reporting rates during COVID, despite all that was going on, which was a curious thing, because she was in Wales, I think the point she was making is that they've done a good job in making sure that people do actually put the reports in, which is a good thing. And it's good that she's saying that, but she was actually celebrating it. But on the other hand, she was talking about the fact that they were using AI to monitor the COVID vaccine reports submitted to Yellow Card. And what she said was that they'd modelled and expected 100,000 reports. But very quickly, they got in, and she didn't say how quickly, but very quickly they received 500,000. She said, so the AI was really important. So basically, they were using, actually, they didn't really use much AI. I think they were just, doing some sort of standard text, some simple sort of text analysis. There wasn't much AI there. But the point is, she was admitting how massively they underestimated the scale of the reports that were going to come in. I mean, they knew they expected a lot more than for any other vaccines. She admitted to that, but they didn't realize how many more.
Interesting too, she's also admitted that the MHRA don't have enough scientists. I mean, and as you've rightly said, she's almost proud of it, but she says, we don't have enough scientists to look at each individual yellow card. There are so many of them. It's staggering to listen to, and listening also to Cheryl Granger, one of our UK column viewers, and we've previously interviewed Cheryl. She got onto the MHRA board meeting and asked about the doses, and the fact that the serious adverse reactions we were looking at were one in, I think it was 426 doses. And she literally, Stephen Lightfoot, the chair of the board, said that this was not the opportunity. We shouldn't use this board meeting where everybody is around, including the chief safety officer. We mustn't use this opportunity to discuss this dosing serious adverse reactions. So I think my question too, and also the whole thing about AI, we know that the MHRA have been saying they've been using AI, but then on the other hand, they say they're not using AI, so they don't seem to quite know what they're doing, which we know about. But I guess my big question to you is, if we're looking at Wales, which we know Wales have a yellow card reporting centre, a specific one, but if their reporting rate is 4 times higher, and if we look at the round, at a guesstimate, what would you say percentage of serious adverse reactions we are looking at in reality, do you think?
I believe, as I said there, that I'm convinced less than 10% of those in the UK are being reported to yellow card. I mean, we've got lots of, well, there's anecdotal evidence of this. I mean, I put in all the kinds of reasons why we believe there's underreporting, but this is something, of course, I have personal experience with. It's not just that the underreporting; it's the fact that going back to the sort of the follow-up, there's no follow-up at all. I mean, I submitted a very, very serious adverse event report, and I never even got. And there's never been an acknowledgement, let alone any follow-up. And from my understanding, there's never any follow-up on this stuff. So there's no real incentive for people to report. There's many disincentives. In many cases, there's nobody, when there's a death, there's actually nobody who's prepared to take responsibility to submit a serious adverse event. I mean, I went public on some of my personal experiences on this. I mean, when the vaccination program was rolled out at the end of December, beginning of January, a father of a friend of mine who was elderly but in perfectly good health died within 24 hours after getting the vaccine. But the family absolutely, when I sort of just mentioned the possibility maybe there's something going on here, because at that point I wasn't even aware then of the seriousness of what might how it might end up, but absolutely nobody was even considered this. It was considered to be, I was a crazy person just to suggest this. So no way was anybody reporting that. And many other examples, I know where it should have been reported. Of course, there was nobody prepared to report it. And we know there's this massive underreporting, and that Wales data just gives us some extra insights into the extent of the underreporting.
I guess my next question is why is June Rain using Professor David Spiegelhalter's data, and what are your thoughts on using Professor Spiegelhalter's data?
Very interesting question, because David Spiegelhalter is completely dependent on the sort of government data, right? Whether it's from the Office for National Statistics or wherever. And we have shown that data is massively flawed and systemically biased in many ways in relation to the COVID data. So, for example, in his, she described she called it an elegant risk-benefit model. And it was based on the number of ICU admissions in each of the different age categories, okay? So he was showing, for example, that even in the very young age category, I haven't got the exact details now, the benefits of the vaccine outweighed the risk, because he was saying that there were proportionally more ICU admissions in that age group with COVID than there were with serious adverse reactions to the vaccine. So even in the youngest age group, it's saying, well, you've still got a risk benefit here, but it isn't much. Whereas you go to the older age groups and you've got a massive benefit over the risk. But that data on ICU admissions, for example, we have done some extensive analysis of this based on on multiple freedom of information requests to different hospitals and hospital trusts. We know that the government's data, we know that's all wrong. We know it's massively overestimating the number of COVID admissions to the ICU units. So the basis for the benefit, which is supposedly where you've got to take account of people being admitted for COVID, is completely wrong. And on the other hand, the number of number of ICU admissions for adverse reactions to the vaccine is, of course, also massively underestimated. So he's got it wrong on both of those factors, and yet that was the basis for this so-called elegant risk model. Of course, she's right in the sense that it is nice. It's a very nice. It's nice to be able to show, if you're able to show the true number, to show the risks and benefits based on the accurate numbers. But when you're using numbers that we know are completely garbage and are systemically biased in favour of the vaccine both ways, then it doesn't make any sense.
Communicating this kind of risk is going to be even more challenging. And here we enlisted the help of experts in the field. We knew from our yellow cards that there was an age distribution, more common the younger you got. And therefore, how could we convey benefit risk, the balance that matters, for different age groups, and also to take into account how prevalent the disease was, how likely you were to need to go to ITU with an infection. And so this was the rather elegant model that helped you to see that the younger you got, that risk-benefit balance was going to be much closer, much narrower. And when the disease actually receded, we were able to raise the age limit under which you would be offered an alternative vaccine.
You've said it all there, haven't you, really? Garbage. And the fact is that we cannot trust the expert, in inverted commas, opinion of Professor David Spiegelhalter. I think that's clear to say. And one thing before I know David's going to finish off our interview. So just before I throw back to David, just to add one thing that you said there, in that I watched a lecture where Baroness Cumberledge, it was a GS1 presentation, and Baroness Cumberledge was on the stage alongside Lord Philip Hunt and Alison Cave. And Baroness Cumberledge said that from her do no harm report, that basically patients had been telling her that yellow cards effectively went into the bin. So, and that's verbatim. She said that that's what happened. Now, she had said that she was shocked. She was absolutely shocked to the core that this was what she was hearing. But clearly, it would appear that even now, despite her do no harm report, which nobody really seems to be taking a lot of notice of, including Henrietta Hughes, our Patient Safety Commissioner, but it clearly would seem that nobody's interested in the yellow cards, and that when you do report a yellow card, it could well be going into a dark void. But I just wanted to throw that in. But I don't know if you've got a comment on that, or whether David wants to come in on either of those comments.
Yeah, I'd like to just briefly come in on that, because that's certainly the kind of feedback that I've been hearing. And of course, the important point is that they've now stopped the MHRA has stopped the regular updating of the yellow card reports for the COVID vaccines. That says it all. You know, I think they say something like that. We now know that it's sort of got a very stable safety profile, and that there's just one other point about that safety profile, because that also came up in her speech, because she was praising the fact that they were using. She was using the fact they were using the so-called method of it's PRR. It's the proportional reporting ratio. It's a method for determining safety signals, right? She was boasting about the fact that they were using this, but she didn't give the results of that. Whereas, of course, we've exposed the fact that the CDC, again, only after a massively long process of finally getting the results from them from the Freedom of Information request, we know that they did this PRR analysis on the Pfizer and Moderna vaccines, and it was an absolute disaster. It's an absolute disaster. There were so many safety signals there that it should have obviously, the whole program should have obviously been stopped from the beginning. And yet here is she referring to the fact that they were using PRR, but not giving the results.
Yes. One of the strangest aspects of this has been the response from MHRA and others to questions. We've been asking questions, and our questions tend to have come from a statistical basis. A lot of it revolves around the yellow card system. Now, anytime I meet someone who reports to me a vaccine injury, the first question I ask them is, did you report it via the yellow card system? I've yet to have someone actually turn around and say, oh, yes. It's either no or I don't know, maybe the doctor did, I don't know. Right, so it's anecdotal, but I'm perceiving a major underreporting just from the people I'm interacting with. When we get to the MHRA, their position baffles me, because when pushed on, okay, thank you, MHRA, you're saying the vaccine's safe and effective, right? Let's consider the safety part of this. How do you know it's safe? And the first thing they'll say is, well, we've got the yellow card system. This is wonderful science. We've got the yellow card system, and this would show if there's a problem. And then when you question them on the data in the yellow card system, they turn around and they start attacking their own data. And essentially they say, well, the yellow card system, anyone can report to that. It's basically garbage. I mean, what can we know from that? So they hold these two opposite views in their heads at the same time. They don't see the conflict. The number one weapon to ensure safety is the yellow card system. So one they mentioned first, whenever they're questioned on this, safety, yellow card system, it's like a knee-jerk reaction. And when you actually push on the yellow card data itself, they attack the system and attack the data. That I've got one other question I'd like to close on, but just on that one, are you seeing this strange, unreal nature of the response?
I mean, it's a brilliant point. That's exactly it, and that comes through very strongly in that June Rain speech. Because on the one hand, as you say, that she's saying how successful the yellow card system is in as a vehicle, as a tool for ensuring safety, but actually clearly is refusing to give any of the actual data in there, because if it really was the effective and accurate system that she's making it out to be, would then destroy the whole safety argument. So yeah, it's really interesting. That's exactly what we're seeing. I mean, there was something else actually very, very funny that she said in her talk, which was about this. She mentioned about they'd also got the yellow card data on Paxlovid. And she said, I'm just trying to get the exact quote here, because it's kind of like quite interesting, because she said that she said, we can see it's very safe. We've had very, very few reports. She said, when I last looked, it was only 2 out of 1,000 reports in yellow card were for Paxlovid. She said, well, it might have increased since then. Well, wait a minute. That's a bizarre statement, because we're not interested in the proportion of all reports. We want to know how many reports and how many serious adverse reactions there've been to Paxlovid, and to compare that with other things. But why, again, why is that not itself? Why does she consider that to be such a safety signal when everybody else would think, well, no, there's something wrong here?
Here again, I pay tribute to the work of the Yellow Card Centre, making sure that good data were always available to advise on drug-drug interactions, so that good advice could be given to those contemplating using Paxlovid, which has been the most commonly used antiviral. And to date, we've had a very small number of suspected adverse reactions. When I looked, it was 2 out of 1,000 reports on Paxlovid. Might have grown since then. So really important to see you can make medicine safer by anticipating these risks and having appropriate advice to hand.
I'm so glad you brought that up, because when I watched that video, and I thought it was very strange the way that she said Paxlovid, which I think we should remind our viewers and listeners is an antiviral made by Pfizer. And we've been warning of the dangers of Paxlovid, molnupiravir, monoclonal antibodies for a very long time. And Paxlovid, what she said was 1 in 2,000. Was it 2 in 1,000, which it ended up as 1 in 500, which is a very high serious adverse reaction that nobody seems to be talking about. So I'm really glad that you raised that. Have you got anything else to say on that Paxlovid statistic? Because I was horrified by it, to be honest.
It was the ambiguity of it, because she said only 2 out of 1,000 of the reports. So actually, I understood that to mean that for every 1,000 yellow card reports now, 2 were for Paxlovid. It wasn't that there were 2 in 1,000 or 1 in 500 doses of Paxlovid, which were resulting in an serious adverse reaction. The point is, we don't know that figure. She should be able to give us that figure, but didn't. She just diverted it by saying, picking out what she thought was a low number out of 1,000, which was a meaningless number, and suggesting somehow that meant it was very safe. It's just the whole thing is smokes and mirrors all the way.
And this speaks to a basic incompetence in June Rain, that she would say that. Right, because she's either trying to deceive people, or she really is so statistically inept that she doesn't realise she's doing this. And kind of either one would call her fitness for a post into question. But, there we go. I'd like to finish with a final question for you. As we were looking at the statistics for the vaccine rollout, the UK column early on took the view, do we have a problem here? And this was based on a couple of things. One, the response through the yellow card system, which dwarfed anything there'd ever been. That was a signal point flashing red. But the other one was something more subtle. And we're seeing this. We've got this very strongly in some data from Scotland, that when they started to roll out the vaccine, they did it initially to the elderly, specifically in care homes, but then more broadly, and they did it in age group cohorts. And we were seeing a very strong signal in additional deaths about 2 to 3 weeks following this. And they aligned in the same way that the age-by-age cohort of the vaccine rollout was happening. So they'd vax the 80-year-olds and up, and then 3 weeks later there was a spike in mortality in that age group. And then after a week or two, they'd have done all of those people, and they then were vaccinating the 65 to 80s. And then 2 to 3 weeks later was a spike there. And it mapped really quite perfectly, and it followed the vaccination program. And so there's clearly some immediate reaction. We think this was to do with suppression of the immune system. There's clearly some immediate adverse reaction that's happening, and death is spiking, and it's following the vaccination rollout. So we have a problem. Now, there's been lots of other information has come forward since then to show other correlations between the vaccine rollout and injury and death. In terms of the data which you've seen, in terms of the data which you've seen, what would you single out as the most important data point, the most important data set that says we really have a problem here, we really need to be thinking carefully about this, and the government's position based on this data is simply not tenable? Is there one correlation or one data set that really stands out for you as the one that carries this message most clearly?
Well, there have been some new ones where you look at the most vaccinated areas of different countries, or most vaccinated countries have the highest excess deaths. But I'm very pleased you raised that thing about those spikes in mortality, in excess deaths occurring with the rollout peaks for different age groups, because that we were using the ONS mortality data by vaccination status right from the beginning. That's when we were the first to raise that issue. We published very, very early on this, and we've been on it. We've been on it on all subsequent reports, right? So we point out exactly what you said, that there were these spikes in all-cause mortality coinciding exactly in each age group with the rollout of that age group. So that something was clearly going on. And of course, we said, when you look at the ONS data, this is where the whole scandalous manipulation and corruption of the data comes in, right? The ONS was saying, well, actually, those peaks that you're seeing are in the unvaccinated, not the vaccinated, right? They're suddenly dying from non-COVID at an exceptionally high rate. And and of course we said, no, that's evidence, as we know, that you're misclassifying those people who are dying shortly after the vaccination as unvaccinated, right? Because why would somebody who's unvaccinated, why would the people who are unvaccinated suddenly start dying of non-COVID deaths at the time when they're vaccinated against COVID? And similarly, why would the people who have been vaccinated stop dying of non-COVID deaths? Because that was also observed. That's why you knew that the ONS data was all systematically flawed with this misclassification. And what did they come back with? They came back with this ridiculous nonsense about the healthy vaccinee effect. They were saying, well, what's happening? What's explaining this is that those peaks that you're seeing in excess mortality in the unvaccinated is because when the vaccine rollout is happening, the people who are close to death are being refused the vaccine. They're not given the vaccine, which is absolute nonsense, because actually people with multiple comorbidities and people actually who are known to be close to death were actually prioritized for the vaccine. So it's rubbish. But so we maintain that that data set, where you look at those the timeline of the excess, those peaks and the rollout was always a very powerful indicator. But so that is one big important data set, and the other, I think, are the various data sets that we're seeing from around the world, where you've got these very, very strong correlations between the vaccination rates and the excess death rates.
Yeah, this is a good point. This reminds me of the recent article on looking at the number of people who identified as transgender in the most recent census. It actually correlated with the number of people who didn't have English as a first language. And the more people you had who didn't speak English as a first language, the more people you had answering this census question to identify themselves as transgender. And what's happening there is they didn't understand the question. It was a bizarre question. They didn't know what it was, and they ticked the wrong box. Seems to be the logical answer. And looking at the data carefully, in this case, and certainly in the case of everything surrounding COVID and the vaccination program, is vital. Can I ask Debbie, would you like to say a final few words before we close?
Do you know what? I'm just so grateful that we've got people like Professor Fenton to be able to tell us the truth, because, and I get what Professor Fenton says, that, you're close to retirement and it's more difficult for younger doctors and experts to be able to speak out. But I think my big message is that it's even more important, I think, to remember that you have a lot to lose, Professor Fenton. You're very established, you're a world expert, and you're bravely standing up and speaking out. And thank goodness that you are. And for me, you are who makes an expert in people. You have a lot to lose. You're not making anything from speaking out and speaking the truth. And I think there's much more data that we need to analyse, including in that lecture, some data that June Rain put out with regards to results on pregnant women and the injection. So I think there's far more to talk about. And I know that you yourself are talking up about the whole net zero, going away from pharmacology and vaccines, but you're talking about net zero. So I think there's an awful lot more to talk about. And I just like to thank you so much. And from my perspective, also, just to give you the last word, because I always do, is what would you be saying to the public that are listening today? My thanks, my huge thanks to David for his contribution, and to you as well. And David might well want to come back after this, but what is your message to the public and to our audience that are watching this? What is their big takeaway from this, do you think?
Don't believe the data that's provided by the governments, and try and find out from those who are kind of like dissenting against the official COVID narrative. Go and find those people and see what they're saying, because that's where you'll find the accurate analysis of the data.